So it's a good idea before we start, you have something to sit on, something firm, perhaps like a yoga block, or some use meditation cushions. The idea is that when you sit, you want to be stable and comfortable. So your knees should be below the hip bones. If your knees are above the hip bones, all the muscles around your hips, psoas, iliacus muscles, they will be crying, they will be contracted. And no matter how hard I try, it's not going to be stable and comfortable to be upright. So unless you have really open, available hips, sit up higher. Sit on a yoga block, something firm, so the hips are higher than your knees as we go through this exercise. So you'll feel more comfortable and you'll breathe and feel that inner space that we're about to explore. The diaphragm muscle is located at the base of the ribs. So I want you to place your hands on the base of the ribs. Now, once your hands are there, you can close your eyes. So everything external becomes a background. The internal space becomes the main focus. Then you take deep inhalation, deep exhalation. Just sense how much the ribs expand outwards so much. How much they soften and dry as you exhale. Please do this 4 to 5 more times on your own. From this inner movement, that we're going to assess and mobilize the ribs and the T-spine. This area has the most potential for movement. And when this area is mobile and moving, your shoulder girdle feels more support. Your shoulder girdle will feel lighter. So the exercise is quite simple. You want to use minimal effort. I'm using minimal effort to gently guide the right side of my ribs to go to the left. While I do that, I sense my spine. Is my spine adapting and going to the right? And then inhale, I come back to center. Then I take the left side of my ribs, I just gently guide it to the right side. Sense the spine adapts. Inhale, I come back to center. Do that 3 or 4 more times on your own. You're assessing how the ribs and the spine interact. At the same time, you're mobilizing it because you're doing some very gentle side bend. After you're done, you release your hands down. You take some nice deep breath to the sides of the ribs. Sense if there is more inner space or inner movement. Follow. So the areas we're going to tap will be the armpits, the top of the ribs, middle part of the ribs, and the bottom of the ribs. I'm going to start with my left side, which is the right side for you. So I'm going to reach my left arm up. And as I side bend, I'm going to put my right hand down. Inhale, I come back. Exhale, I side bend. Inhale, I come back. I can even think about reaching up more and side bend. Then on the next time when I side bend, I'm going to stay in the side bend and then use my other hand to gently tap around the armpit. You can tap around the armpit, move to the top of the ribs. Your head is like trying to find treasure. Which area feels more restricted? You can stay there a bit longer. Then you press the sit bones down to come back, and then you release your arms. Then you channel the breath to the areas you are gently tapping. The armpit, the top of the ribs. Make a mental note. Is it easier to breathe into the side that you were just tapping in comparison with the other side? Still working on the left side, but the second round. The arm comes up, reach up, side bend. Inhale, come back, side bend. We stay here a little bit. Use your other hand. You're pushing yourself away. So the right side of my body is going to the left side. The left side should feel a bit more stretch. And if you collapse, you're not pushing. There's a different quality of the stretch in comparison with when you push the ground away. There should be more left. Come back 2 more times. Extend inside bend. Float and dance. Extend inside bend. Again, we stay. This time we go to the bottom of the ribs. We tap from the bottom of the ribs, from the front to the back. Then we work our way up to the middle of the ribs. 3, 2, 1. Then once we come back, release both arms again. Breathe into the bottom of the left ribs. Breathe from there all the way to the armpit. Again, ask yourself, is it easier to breathe into the left side of the ribs now in comparison with the right side? So now we're going to repeat the second side. So I'm going to reach my right arm up. Think about anchoring the sit bone, reaching the arm up, and then I gently side bend to my left. And then inhale, I come back 3 more times. Exhale, go. Inhale, come back. Exhale. Inhale. On the 4th time, we stay. As I stay, take your left hand, you gently tap around the armpit. And you can explore different areas of the armpit. Go to the back, go to the middle, the top of the ribs. Then inhale, I come back. Exhale, release.